Sebestian, who's going to be talking to us about the meniscal root repair technique.
So the message of this session is save the meniscus. So we have to learn all the technique, many technique for many kind of injury. Save the meniscus is the message for all of us. And I will speak about the meniscal root injury. Okay, it is a severe injury where sometimes is missed in our diagnostic arthroscopy. As you say, as you know, the definition of a root injury is a radial tear located within 1 centimeter from the attachment of the root in the tibial plateau. The general concept of this injury are it is a very frequent injury, but often is missed in our diagnosis in the MRI or in the arthroscopy as well. Biomechanically, is compared with a total meniscectomy. If you don't repair the root, the knee will work like a total meniscectomy and it will develop osteoarthritis very early on time. In order to do the diagnosis, we can suspect something in the physical examination. The MRI, there are 3 signs where we should know, and the definitive diagnosis is under the arthroscopy. I use the classification of Laprade in order to see how is the stage, how is the grade of the injury, and on terms of the classification, we will develop the treatment. We will do the treatment. Basically, there are 5 stages, 5 types of root injury. And when we face the treatment, we can see that we have 3 options: conservative treatment, non-operative, meniscectomy, and root repair. It's very important, the classification. At the definitive treatment, we will decide in the surgery, because sometimes the MRI is not so clear. This is a partial grade 1, type 1 of the classification is a partial tear. I think this injury is no need to be repaired. We can make partial meniscectomy in the root, but if you see, it's attached in the bone, so no need to repair. When we face type 2 until type 5 injuries in the classification, we have to think in root repair. There are many techniques. My favorite technique is trans-tunnel pull-out technique, where you can use the tibial guide in order to perform the tunnel, and you need a scorpion or suture lasso passing sutures. You can use 1 tunnel or 2 tunnels. There are many techniques described that some doctors use 2 tunnels. I use only 1 tunnel, that I will show you how I do it. And also you can make 2 or 3 sutures in order to fix the root. This is a small video. Always you should have a systematical technique. So first of all, the tibial guide. Second, you have to create the debridement in the cartilage. I use the drill 4.5, the one that you use for the bottom. And then I make a laceration in the cartilage in order to heal the meniscus in the bone. After that, I pass the suture with the scorpion. I do a sliding knot. I use the first one to pull the meniscus, and then I can do the second one. If you have problem with the condyle, you can make with the burr notchplasty. You can open a little bit the space with the burr, no problem. Even it will help for healing of the root. As soon as we have the second suture, you see the stitches, you have to take a good tissue, otherwise when you pull, you can break and you can tear the meniscus. And with the pincer retriever, through the tunnels, I recuperate the suture and pull the suture down until the position of the root footprint. In type 3, also, sometimes you have to remove part of the meniscus because if there is a flap, and then the remaining meniscus, you can do the repair with the transtunnel. Sometimes you need 3 sutures because the medial part of the meniscus is big, and I think it's good if you can repair as well in the same tunnel. And also, if there is any avulsion, you can take all the bone. If there is a bony avulsion, you can take also the bone and attach the bone also in the position of the tibial plateau. Always the technique is the same. First of all, make the identification of the injury. Then you perform the tunnel with the drill number 4.5. Make the one, in this case I'm doing 3 sutures as well, because you will see that this is a very unstable injury. So I use non-absorbable sutures, fiber wire or whatever company you work. And after that, you have 2 possibilities. The first one that I show you with the retriever, you recuperate the sutures, or in this case, you pass whatever loop of suture and you pull the suture down with the non-absorbable suture through the tunnel. In this case, I thought that it was also very important to make a double support of the root because it was like a radial in the peripheral area. I use a meniscal repair all inside technique, and I make the double fixation in order to close this small gap that I see in the root injury. The importance is to create a stability in the meniscus, as you see in the image. The fixation, you can do it with also many options. You can use with button, with the anchor. You can use a bone staple. Also, if there are 2 tunnels, you can make the suture with the tunnel of the ACL, with the suture remaining, and also with the anchor or any device that you want to make the fixation. The aim of this technique is to create a stability. You see pre-op and you see post-op. Also, the root injury creates too much instability in the knee. So the conclusion for this technique are that don't miss the root injuries when you do the MRI. Also look for all the surgery that you have ACL injury. Look for the root. 3 signs that I didn't mention because of the time in the MRI. The definitive diagnostic is the decision. You do it during the arthroscopy, and doesn't matter the age or the surgical treatment. So the important is the prevention of the osteoarthritis in the future if you repair the meniscus. The surgical technique is transtunnel is the best option for me. And the distal fixation, you can do it whatever device that you want. Thank you.